And one of the passions that you have now is talking about mature minors and their ability to consent to immunizations for themselves. Can you tell us a little bit about what this means and why it's important?
Well, there's a small number of states and jurisdictions that have what are called mature minor doctrines, which means that an adolescent of some age, depending on where you are, has the ability, if they demonstrate to their healthcare provider that they are capable of listening to the information you give them and making decisions about their healthcare, that they're allowed to do that without parental consent. So in the state I was in, it was 14. I think Washington, D.C. just passed 16, I think, if I'm remembering that correctly. And then there's a smattering of other states and jurisdictions that allow that. But um, basically, those kids, those adolescents, if they were comfortable, they could consent for whatever. And when it comes to immunizations, that's really helpful if you have maybe parents who are divorced or just not on the same page with whether or not a child should be immunized. And sometimes those divorced couples, one of them says, well, I'm going to take you back to court if you allow our child to get vaccinated. And so if that kid is an adolescent in one of those jurisdictions, then they have the opportunity to consent for themselves, and that makes it so that the other parent who believes in science doesn't end up on the hook and back in court or something. And then where it's really, really important is in foster care. And in Tennessee, they have now um, not only reversed their what was on the books for their mature minor doctrine when it comes to immunizations, but now they've said that your biological parent has to provide written consent. And so if you're in the foster care system and your biological parent is incarcerated or impaired or dead, um, you may not be able to get vaccinated now in the state. And they said that they were going to fix it in this legislative session, and they didn't. And so you've got these kids, even babies, that are in foster care or you can't get consent from a biological parent. And so we have babies that are not able to get vaccinated now, which is really horrible.
So, why are we in a place today where minor consent is controversial? And has it always been this way?
I think in a lot of cases, these policies have sort of been under the radar, and they've used them in like Department of Health and Department of Children's Services as, kind of what allows them to do the work that they do. But now, as they've kind of came to light, I think a lot through COVID, um, it's seen as trying to undermine parental authority. And so these knee-jerk reactions to pass laws um, that strengthen parental control over their children, um, they have not thought about the collateral damage, like kids that are in the foster system.